mandated under the Affordable Care Act, but most of the changes will not come until federal agencies adopt regulations after an opportunity for public comments, a process that could take months. Mr. Trump directed 3 cabinet agencies to develop rules that would expand access to less expensive, less comprehensive insurance, including policies that could be sold by trade associations to their members and short-term medical coverage that could be offered by commercial insurers to individuals and families. Joining us now on the Howie Carr Show is Dr. Peter Warinner. He is the author of the book, The Art of American Healthcare, which is available at Amazon.com, The Art of American Healthcare, and he is the director of a CNS multi-specialty clinic in Wellesley, Massachusetts. Dr. Warinner, thanks for being with us here on the Howie Carr Show.
Sure, thanks for having me, Howie.
So what do you make of this? Is this a positive development today that the consumers are, in a few months, apparently going to have more choices?
I don't think so. I think President Trump is very well-intentioned, but the ends do not justify the means. He's trying to potentially use the federal government to force states and individuals to do things that they wouldn't otherwise do. Healthcare is something regulated on a state level, and so is healthcare insurance. It's somewhat of a myth that you can't buy insurance across state lines. So, for example, you've heard of, let's pick a company, Blue Cross Blue Shield. They have a presence in Massachusetts. They have a presence in Florida. They have a presence elsewhere. So the problem is there are different rules and regulations in each state, so they have to tailor or customize or tweak their plans to meet with the regulations in each state. So I believe what President Trump is trying to do is say, well, let's let the federal government say that let's step in and block the states from regulating something that they have every authority of regulating. And, it's understanding the Constitution. The federal government does not have the authority to do that. The Constitution specifically blocks them from doing that. So I'm not so sure that this is a good idea.
Well, but on the other hand, Dr. Warinner, you and I live in Massachusetts, where we had Romney Care before there was Obamacare, and so you have all of these requirements of that you have to buy certain types of health insurance that most people don't need or don't want. And so if we could get out from under that in Massachusetts and buy a cheaper policy that would provide us with the services we need, I mean, Obama used to call them bad apple insurance policies, but most people were satisfied with those bad apple insurance policies. Today, they're calling them junk insurance policies. But again, not everybody needs baby dental care policies, do they? I mean, that's just not in the cards. But a lot of us have to buy that anyway. Isn't this a way around that?
Well, again, I agree in principle, but the ends doesn't justify the means. So having the federal government step in and do something that I think is arguably unconstitutional, what we need is to get the federal government in particular, out of healthcare, not entangle it even further in regulating healthcare and healthcare insurance. So I think a better way around this is an executive order to just grant waivers for every individual and every company and every state. And I don't understand why President Trump can't do that. Just grant waivers. There are plenty of waivers that were granted under President Obama for unions and certain companies, certain individuals. Why can't we just grant waivers for all? And then that's a way to abolish the effect of the Affordable Care Act, or what I'm calling now the Mitch McConnell care. It's no longer Obamacare. Mitch McConnell owns this one.
Well, haven't they already said they're not going to collect fines if you don't buy the policies, or was that part of the most recent failed effort?
Well, it may be what the president is going to direct the IRS to do or not to do, but I'm not so sure whether that was actually legislated.
Yeah, I'm not either. There was an interesting piece though, I think in the Wall Street Journal a few weeks back, saying that they all these talking heads are coming on the network newscast today like they always do, saying this is going to hurt poor people and this is going to deprive people of medical insurance and better health care, et cetera, et cetera. Yet most of these fines for not paying for not buying the Obamacare policies were being assessed against people who are not high income types, and it amounts to billions upon billions of dollars.
Yeah, let's remind everybody that as some of the tenets of the Affordable Care Act, it requires people to have health insurance policies, and the government to a certain extent will help support and finance the purchase of such policies. But once you have the policy, you have to use it. And then embedded in the policies is co-pays and deductibles.
Right.
And so whereas people used to get free care from doctors and hospitals, now they're not getting free care. They're being charged for care, the so-called co-pays and deductibles, even though they're not paying for their policies.
Right. If you're paying $12,000 in a policy and your deductible is $12,000, then that basically means you have to come up with $24,000 after taxes before you can get a single bit of quote-unquote free health care. Let's move on, Doctor. I want to ask you, you've seen this story about this pharmacist up on Capitol Hill. He's bought this century-old and more pharmacy that has apparently delivers the prescription drugs to most of the members of Congress. And this pharmacist gave an interview, and he said, at first it's cool, I'm filling some drugs that are for some pretty serious health problems. And these are the people that are running the country. It kind of makes you sit back and say, wow, they're making the highest laws of the land, and they might not even remember what happened yesterday. And so it seems to be that sounds like he's delivering drugs that have been prescribed for Alzheimer's or dementia.
Yeah, there are so many things wrong. I read the transcript. There's so many things wrong with that. Violation of privacy. Say what you want about Democrats, Republicans, conservative, liberals, politicians. They're entitled to their privacy, and they should have it. So not a single one of them should have been implicated as having any serious disease or disorder that's being treated. So that's just a terrible violation of people's privacy, even if individual names aren't named. There's only so many people there, so you could probably start to guess. What's more is in his transcript, I found it very interesting that he says that these prescriptions are all phoned and none of them are ever sent electronically. Well, as a part of the Affordable Care Act and other federal mandated regulations, the physicians are required to submit electronic prescriptions. So why is it that everyone in the Capitol, the politicians, our representatives, are exempt from this that other physicians and patients have to deal with? There's another hint as to the fact that they make these regulations, but they don't conform to them themselves. It's for everybody else, not for them.
The interesting, I agree with you about the violation of privacy and all that, but you have all these cases now, Doctor, where these members of Congress are in their 80s and they're running for re-election. And I'm not making accusations against anybody in particular, but like Dianne Feinstein, for example, she's 84 years old and just a senator from California just announced she's going to seek another 6-year term as a senator. Orrin Hatch, who's also, I think, 84, 85 years old, senator from Utah. He's thinking, maybe not going to, but he's thinking about running for re-election. Do you think people in their mid-80s should be running for new 6-year terms?
Well, this topic in general is actually covered in my book, The Art of the American Healthcare. And the way I cover it is not specifically age, but it is health issue related. There are people working in our government, whether it's federal or state level, and regardless of branch, there are people who have alcohol addiction problems, drug addiction problems, dementia, other forms of cognitive impairment. Some of them are permanent and progressive conditions. And in my professional opinion, there should be some mechanism by which this should be reviewed, analyzed, and perhaps these people should step down, or there should be some mechanism in place whereby we, the people, can force them to step down due to their impaired judgment. It's terrible.
Yeah, and you see these people on TV. I won't mention any names, but you see them on TV some night, and they're addressing audiences or talking to interviewers, and they totally lose their train of thought. And you begin to wonder. I mean, should this person really continue to be in a high elective position when their minds appear to have to not be what they once were? I'll leave it at that. Dr. Warinner, what's the title of your book?
The Art of American Healthcare.
Dr. Peter Q. Warinner, thanks for being with us here on the Howie Carr Show. I appreciate it. I'm Howie Carr.